Hello, this is Mark Rothstein with a brief COVID update in which I'm going to focus on the new booster just approved by the FDA and recommended by the CDC. First, my usual disclaimer that I'm not a physician and nothing I say should be considered medical advice. I'm also not an epidemiologist, virologist, or any other type of scientist. My background is in public health ethics, law, and policy. I have served as an advisor to the CDC on coronavirus policy for several years, and I have written widely on the public health response to COVID. This video is being recorded on September 13th, 2023. I want to address three issues today. First is the current state of COVID in the United States. Second, the new booster. And third, I want to close with two bright spots that you might like to hear about in our fight with COVID. So first, on the current state of COVID in the US. As I'm sure most of the viewers know, the US is experiencing an increase in the rate of COVID cases. And this we can see through test results, wastewater levels, emergency department visits, hospitalizations, and even deaths. Although the numbers remain far below the levels during the darkest days of the pandemic, which we all remember, of course, they are still concerning. So let me just give you one example of the kind of figures I'm talking about. Deaths in the US from COVID in August of 2023 rose about 18% from the prior month to about 600 deaths per week. Obviously, that is 600 too many. But in August of 2022, last year, there were 3,000 deaths per week. And in August of 2021, there were 14,000 deaths per week. So we should keep this increase in perspective. Today, there are three new subvariants of interest that represent a growing percentage of the COVID cases. But so far, none of these three are what we might consider to be game changers in COVID. It's not clear what caused the latest spike in cases. It could be some combination of more transmissible variants or seasonal changes in exposure or waning immunity from prior infections and vaccinations. The good news is that there has been an overall decline in the severity of COVID cases. And experts think this is perhaps due to a degree of what's called hybrid immunity, because an estimated 97% of the population has been vaccinated, infected, or both. Even so, I think we need to all remember that COVID should not be taken lightly, and it remains a serious threat to public health, especially for individuals over 65 and those who are immunocompromised. Now let's talk a bit about the 2023 booster that was just approved. And when I say just approved, I mean yesterday, September 12th, 2023, the CDC recommended two what are called monovalent boosters produced by Pfizer and Moderna. Another company's vaccine, the Novavax booster, is still under FDA review. Now, unlike last year's bivalent booster, which targeted both the original strain of COVID and the leading variant circulating at the time, this year's booster is only targeted to what's called the XBB 1.5 variant. That's why it's called a monovalent and not a bivalent booster. The new booster seems to be effective against all the latest circulating strains of the virus, and over 90% of them are closely related to the XBB 1.5 variant that was the target of this booster. The timing of the release of the booster is especially helpful. The maximum effectiveness of a vaccine or a booster occurs between 2 weeks and 2 months after the individual receives it. And getting the booster in the next few weeks aligns with the expected peak of COVID cases in the US in November or December. It's expected that boosters should be widely available within the next few days. And of course, that would be excellent timing. The CDC recommended a booster for everyone age 6 months and above. So if you recently received the older booster or your primary vaccine series, you should wait 60 days before getting the new booster. If you recently had COVID, you should wait 90 days from your recovery before getting the booster. I've been asked, can you get the new booster and your flu shot at the same time? And the answer is yes. Also, it's not necessary to get a booster of the same vaccine as your earlier primary vaccine or booster. That means that you can safely and effectively sort of mix and match the Pfizer and Moderna vaccines. So take whichever is available. For high-risk people, such as the elderly and immunocompromised, it's possible that another booster also will be recommended in the spring, because protection drops off significantly for these individuals in 4 to 6 months. Now, an important public health concern that I face every day is that only 17% of Americans received the bivalent booster shot. And unfortunately, I can't see the new one having a significantly greater uptake. Put simply, boosters are safe, effective, convenient, and generally free. I don't know what else there is to say. I can tell you that I will be getting mine as soon as possible. And after this slightly down segment, I want to close by telling you about what I think are two bright spots on the horizon in the fight against COVID. First, for many people, a leading concern that they have is the risk of long COVID, which is characterized by persistent, debilitating symptoms months or even a year or more after their initial infection. Regrettably, treatments for long COVID are still not very effective. However, the risk of getting a new case of long COVID is declining and controllable to a degree. People who are vaccinated and boosted have substantially lower risks, which takes their risk from the 10 to 20% range to below 10%. Also, taking antivirals like Paxlovid shortly after you become infected further reduces the risk of long COVID. So I think that's good news. And if you think about it from the biology, it makes sense. The more your immune system is fortified through vaccination and boosters, and the less sick you become due to antivirals, the lower your risk of acute and chronic complications. And that's why there are fewer new cases of long COVID now. Finally, the second hopeful development involves the 3% of the US population, roughly 7 million people, who are immunocompromised. You might recall that a drug called Evusheld was a pre-exposure pharmaceutical product for people who could not take or significantly benefit from the approved COVID vaccines. Because of the emergence of new variants as this virus continues to mutate, this drug became ineffective. And in January of 2023, the FDA revoked its emergency use authorization. Last month, the government announced that it is funding new preventive antibody research conducted by the drug company Regeneron. And according to HHS, drug trials are expected to begin this fall, almost any time now. So maybe there will be a successor to Evusheld before too long, and that would be very good news. So that's it for today's brief update. As always, I hope you are well and will stay well, continuing to take necessary and reasonable precautions against COVID and other health risks, and still enjoying life. Thank you for watching.